Folks, Nick the Nurse here. Today we're going to be talking about some of the nursing interventions that you might see come up on nursing school exams or on the NCLEX that deal with the nursing problem of hyperthyroidism. Very testable, okay? Nursing interventions with hyperthyroidism can include providing a cool and restful environment with little stimuli, okay? Because these patients are always going to be what? They're always going to be hot, okay? Obtain daily weights, monitor vital signs, provide a high-calorie diet. Now, you don't normally see that in a lot of other nursing interventions for other particular nursing disorders or problems. So make sure that you remember that a patient with hyperthyroidism is going to be ordered a high-calorie diet, okay? That's something I might test if I was a nursing school instructor. And I am. I have been a nursing school instructor both in RN and LV and LPN programs, and I'm a certified nurse educator, so I've tested this stuff frequently. Administer IV fluids as ordered. You want to administer iodine as ordered. Because remember, patients who develop goiter, oftentimes one of the risk factors for a goiter is decreased iodine levels. And patients who live in the middle of the United States or inland in any particular country or continent in the world, when people are away from the coasts, they don't tend to eat as much seafood. And in seafood, there's quite a bit of iodine compared to other food. So a lot of this has been eradicated over the last 20, 30, 50 years through iodized salt that we put on a lot of our foods in the United States. But definitely think about that. Iodine you should associate with goiter a lot of times. Not always, but sometimes. Anyway, we want to make sure that we monitor intake and output. We want to administer beta blockers to treat tachycardia as ordered. We want to administer PTU or Tapazole to lower thyroid levels if ordered. And if the patient is taking these drugs, we need to monitor for signs of hypothyroidism, which can be seen if the patient is indeed overdosed on these drugs. We want to provide good eye care and protection for the patient who has exophthalmos. Assist the physician in preparing the patient for a thyroidectomy if it's ordered. We want to make sure that we prepare the patient for radioactive iodine treatment, if that is ordered. Monitor for signs of thyroid storm. Now, signs of thyroid storm can include hypertension, apprehension, hyperthermia, tremors, nausea, vomiting, restlessness, abdominal pain, tachycardia, dysrhythmias, respiratory distress, agitation, confusion, delirium, coma, and even death. So we need to make sure that we understand, okay? Excuse me. And we also need to be able to provide interventions if the patient has thyroid storm. And those interventions can include, okay, maintaining a patent airway, always uber important, okay? Monitoring for dysrhythmias, monitoring vitals, administering antithyroid medications as ordered, using a cooling blanket, administering non-salicylate antipyretics, as salicylates increase thyroxine levels, and providing cool sponge baths. All of these things are good interventions for thyroid storm. So a lot of good information there. Make sure that you understand it. If you'd like to check out any of my other completely free videos, you can see them at www.nickthenurse.com. Again, that's www.nickthenurse.com. I'd like to thank you for watching, and I'll see you next time.